Good evening, guys. This is Dr. Paul, serving humanity through medical education. Once again, good evening for watching this video. And as always, we invite you to visit our website at www.usmlevideos.net. That is www.usmlevideos.net, where we have posted hundreds of videos for USMLE examination. Tonight, I want to talk a few minutes about post-traumatic stress disorder. You know, I don't have to repeat how the world is becoming such a anxious, stress-filled world. There is so much terrorism going on, so much wars are going, so much violence is going on, accidents are going on. So there are plenty of people who share PTSD. Now, PTSD is characterized by an exposure to a traumatic event. It may be a war, it may be an accident, it may be a murder, it may be something that happened that distressful to the patient. And there is this distressive recollection of the event that even comes back like flashbacks or dreams. And the patient persistently avoid those stimuli associated with the trauma. Like he avoids those thoughts. He struggles to avoid those thoughts. He struggles to avoid those places associated with the trauma. He struggles to avoid the people associated with it. And also that increased arousal, like difficulty to sleep, insomnia, difficulty to concentrate. And the important thing is these symptoms must be present for at least 4 weeks. If it is less than 4 weeks, it becomes acute stress disorder. So what are the symptoms and signs? As I said, helplessness, avoidance of thoughts or feelings on the people or the places, and hypervigilance, like a patient always just he gets up and he becomes hypervigilant. And that's a characteristic symptom of PTSD. He says the flashbacks are coming, the dreams are coming, and he just can't remember sometimes even minor things. So sometimes forgetfulness, sometimes decreased concentration. So these are the important things in the signs and symptoms. Now, diagnosis, there are so many scales. Combat Experience Scale, CES, is one scale. There is PDS, Post-Traumatic Stress Disorder Diagnosis Scale. There is CAPS, Clinician Administered PTSD Scale. There is SCID, Structured Clinical Interview for DSM Disorder. So all these scales we can give to the patient. One of it, you can decide one, and the patient has to fill up things, and based on those skills you diagnose this patient. How do you treat? Number one, psychotherapy, behavioral therapy, cognitive therapy, exposure therapy, then SIT, stress inoculation training. There is a CPT, cognitive processing training. Then CBT, cognitive behavioral therapy. There is eye movement. You synchronize eye movements, the eye movement therapy. Then bibliotherapy, religious help, helping people to find God and comforting with that. Then if you come to pharmacological therapy, there are SSRIs, fluoxetine, fluoxamine, citalopram, paroxetine. These are SSRIs. SSRIs are the first line therapy for PTSD. Then comes MAO inhibitors like phenelzine. Then comes tricyclic antidepressants like imipramine, desipramine, amitriptyline. So tricyclic antidepressants can also be used to treat PTSD. Then comes anticholinergic agents like antiadrenergic agents like clonidine, guaifenesin, and propranolol. These antiadrenergic agents, they decrease that adrenergic output, so it treats that increased cardiac output in these patients. Then beta blockers like propranolol, they decrease the autonomic output. Then alpha blockers like prazosin, those are also helpful. So that's about treatment. Now let me stress some important points. If PTSD is less than 4 weeks, it is acute stress disorder. So 4 weeks is the clinical criteria to diagnose PTSD. Then What are the first line therapy? SSRIs. Now let me give you a case. Patient is a 23-year-old soldier returned from Iraq. He says he is happy that he is reunited with his wife and kids and friends and family, but still he is having some problem. Those combat operations he was involved in Iraq, they are coming back as flashbacks and dreams into his mind, and he is becoming hyper vigilant. He became anxious about events, even when he is with his family. He is trying to avoid those thoughts and the people and the places associated with. And he's also unable to recall some important events. Now, what is the most commonly used first line therapy in this patient? Now, this question has two parts. First of all, you should be able to diagnose this condition. Then secondly, you should be able to tell what kind of medications are used as first line therapy in this condition. First of all, what is this condition? The soldier came from the war. He is united with the family, but he is still struggling with those memories back in the war, and he is struggling with those flashbacks, with those dreams. And then he has difficulty concentrating, he has difficulty to sleep, he has difficulty to remember things. So he has all characteristic symptoms of PTSD, and he has those symptoms for more than 4 weeks. Then the condition is PTSD. So the first part of the question, you identified the condition, PTSD. Then the second part of the question is, what is the first line therapy? The first line therapy in pharmacological agents. The answer is SSRIs. Fluoxetine, fluoxamine, citalopram, paroxetine, all of those SSRIs, any of them can be used to treat PTSD. So that's about PTSD. If you have any comments, please feel free to post them, or you can also visit our website at www.usmlevideos.net. That is www.usmlevideos.net. You can post your comments and questions. And thank you. This is Dr. Paul, serving humanity through medical education. God bless you.